Good morning, and welcome to today's Oncology Data Advisor interview. Today, I'm joined by our editorial board member, Dr. Jasmin Hundal, who is a Hemonc Fellow at the Cleveland Clinic. Recently, she returned from attending the MASCC annual meeting, the Multinational Association of Supportive Care in Cancer, where there were a lot of exciting happenings in the field of supportive care. And today, she's here to tell us about some of the things she saw and learned there. Jasmin, great to have you on the show again.
Yeah, thanks, Kara. I'm excited to share the abstract that I presented at the conference, and it's definitely a very exciting conference. It's a kind of a very unique conference because we do discuss like clinical advancements, but the focus is on supportive care, and then the other thing, the global representation at the conference and being able to collaborate and communicate with international attendees is always super exciting.
Absolutely, it's a really unique meeting. So looking forward to hearing about your abstract that you presented there. Would you like to tell us about it?
Yeah, definitely. So I presented clinician practices and attitudes in occupational health discussions in our cancer patients. As we know that occupational health plays a critical role, especially within our patients with work and employment during a cancer diagnosis. As we know, cancer is not just a medical diagnosis, it actually affects like nearly every aspect of a person's life, including their identity, financial stability, and ability to work, especially with how we are seeing the increased trend of early onset of cancer. So for many patients, maintaining employment during and after treatment isn't just a practical necessity, but it's also deeply tied to their sense of like normalcy, purpose, as well as well-being. Yet conversations about work are not always prioritized in clinical care. Um, so our study was set to explore how clinicians, including oncologists, nurse practitioners, social workers, and other support staff, approach this topic. So we asked, it was a survey-based study where we asked, like, do they feel comfortable discussing cancer-related occupational issues? How often they talk to patients about employment, and importantly, are they making actionable recommendations to help patients navigate a work while undergoing treatment? So we surveyed these clinicians, and over 90% demonstrated or reported that they do engage in conversation about patients' work situation, but only a minority actually regularly recommended workplace a modification like reduced hours, altered duties, or formal accommodation. Interestingly, we also found that clinicians who frequently discuss employment were significantly more likely to recommend modifications, suggesting that these conversations are a gateway to actionable support. So, what does this tell us? That there's a strong foundation in willingness and awareness, and there's also a clear gap in practical guidance, referral patterns, and possible training when it comes to translating concerns into tangible support for working cancer patients. And why does this matter? Because employment is a key determinant of health. Job loss during cancer treatment has been linked to poor mental health, financial toxicity, and even, worse survival outcomes in this setting. So, as cancer care increasingly emphasizes survivorship and whole person care, integrating occupational health into clinical conversation is not just optional, it's actually essential. So, looking ahead, this work points to the need of structured education, clear referral pathways to occupational medicine, and better integration of supportive services in our clinical day-to-day care. So, by equipping clinicians with tools to address work-related concerns more confidently and consistently, we can better support our patients in both maintaining both their health and livelihoods. So, I'm looking forward to continue working on this aspect and further collaborating with my colleagues at the University of Connecticut, where actually the study all started. So, yeah,
That's amazing. First of all, congrats on a great presentation.
thank you.
Yeah, it's such an important topic to investigate and raise awareness of. So wonderful to hear about your abstract.
Yeah, definitely.
And I know there was also a big plenary session at MASC on financial toxicity. Would you like to talk about this one as well?
Yeah, definitely. So Dr. Chino had a plenary session on financial toxicity, and we do know why financial toxicity is very important, as I just addressed, right? Because financial toxicity severely impacts the quality of life and social well-being. It definitely leads to borrowing, cutting back on essential and leisure, and worsens over time. She also demonstrated it was strongly linked to bankruptcy, which increased post-cancer mortality risk by nearly 80%. It occurs in publicly funded systems due to job loss and indirect costs. Common drivers include out-of-pocket payments, multiple clinic visits, large household size, and private hospital care. She also demonstrated possible interventions and focused on multi-level, patient-centered, and system-based strategy, which is needed. So Dr. Chino recommended screen early for financial distress, disclose consistent and clear cost of care, prioritize high-value care with the best return on investment. She also emphasized to choose wisely guidelines which are present or are able to be seen at ASCO, ESTRO, or SSO, prescribe direct-to-consumer medications when safe and appropriate. And she also underlined expanding access to telemedicine to reduce their travel and time burden. In addition to that, she also discussed supportive services with the early referral to palliative care, providing financial counseling and patient education, offering free transportation and parking assistance, encouraging the use of financial navigators and app-based tools, and lastly, creating financial toxicity tumor boards for coordinated support, and which was very interesting and actually unique, and one would not think about the financial toxicity tumor board. So this was a very unique aspect that she presented there. And last but not least, at the policy and employment level, advocating for paid sick leave and ensuring protection against job loss and income disruption is really, really important.
Absolutely. That sounds like a really great presentation with a lot of
Yeah,
really informative takeaways.
definitely.
And like you mentioned, the financial toxicity tumor board is a really unique approach.
Agreed. Yeah.
Awesome. Any, I guess, any takeaways from either this presentation or other presentations you saw there that you're
Yeah.
back and great?
Yeah, so I think Dr. Chino definitely was a fabulous presentation, very informational, and financial toxicity is important that we do pay attention to this, and it is a modified determinant of cancer care. So addressing it requires integration into routine care, structured policy support, and proactive resource allocation to safeguard our patients' health and financial security. So I think this is definitely important and can always never be emphasized enough. So in addition to our clinical advancements, paying attention to financial toxicity is very, very uttermost important. Again, emphasizing with the younger onset and younger ages that we're diagnosing cancer.
Absolutely. Some great messages to share. So I guess any other themes at MASC that you came across that you'd like to share with the audience? Any take-home messages from the meeting?
Yeah, other themes which I'm always excited about is in the care of like survivorship. So there were great presentations on extras oncology, on how to integrate it into our care. There were a great presentation on symptom management. I attended a breakout session where they discussed trastuzumab and how we use trastuzumab in clinical practice as well as supportive care, um, with being more proactive in symptom management, how to integrate anti-nausea medication, being more upfront at a higher dose, and then kind of like work yourself backwards. So that was very interesting. The other unique aspect of this conference is that all these breakout sessions usually had a patient advocate present, so that was very, very interesting and nice to actually see when 2 or 3 clinicians speak and present the cases as well as present the clinical advancements. And then at the end of the presentation, there is a section for a patient advocate. So seeing what was just presented from a patient's perspective is very, very educational and informational. So to be able to get key takeaways and seeing how actually patients feel when they are receiving that particular treatment. So that was very unique and really like that format of the presentation. And last but not least, I actually attended for the first time a talk about skin toxicity during chemotherapy and radiation, or in general during cancer treatment, which was again very, very informative because we do not have enough presentations I would see on dermatological toxicity, whether it be just dry skin to rashes. So that was also very informative, and we were given like some good proactive tips on giving recommendations to our patients.
Awesome. That's amazing. Thanks for the summary of all the great work that was presented there.
Yes,
Like you mentioned, that's really unique that they had the patient advocate on each panel to help like share their perspectives there.
definitely.
Awesome. Well, it sounds like it was a really awesome meeting. So thanks again, Jasmine, for coming on to tell us all about it. And congrats again on your presentation there.
Yeah, thank you.